This is October 5th of 2022. Would you all please stand and join us in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Item 1 on our agenda tonight is approval of the minutes from our last meeting, September 7th, 2022.
I saw no changes.
I saw no changes as well. I'll make a motion to approve as written.
I'll second.
All in favor?
Aye.
Aye. Motion passes. Item number 2 is Employee of the Month, Courtney Cox.
Good afternoon, Commissioners. So I am here to present Employee of the Month for October 2022, and that's going to be Brandy Davis. Brandy's been employed since July of 2021 and works as a quartermaster for the Emergency Services Department. Brandy was nominated by a coworker who states, "I want to nominate Brandy Davis for Employee of the Month to praise her diligence and foot-down strategy to get things done. When Brandy says she's going to do something, she gets it done very well and in a timely manner. I want to recognize Brandy's efforts and her will to understand and appreciate the roles of other departments in the county. While some may agree that Brandy is an overachiever when it comes to communication, it's a quality benefit of fully understanding the workplace and knowing what needs to be done, making for a healthy and enjoyable work environment." So now I'll let Brandy come up here and say a couple of words, and if anybody else would like to talk on her behalf.
Should we let Sheriff talk first? So the overachiever part, I mean, the over communication part is very true. I make sure that everybody I work with understands everything I'm saying and why I mean it and what I'm doing. But I'm just very thankful and very appreciative for this. I'm done.
So Brandy's a huge asset, especially the sheriff's office. She's an evidence tech as well. So she spends a lot of time locked up in the evidence locker. We let her out every now and
By
again.
myself, where I can't communicate with anyone.
She has a very can-do attitude and just is easy to get along with. So really think she's a big asset.
Thank you.
Thank you.
Item number 3 is open sealed bids for trench roller for Carbon County Road Department. Do we have any bids, Seth?
We have one. Oh, I'm sorry, 2. Didn't see this other one. This first one's from A1 Rental. Says that it's a multi-quip 1575 remote compactor and it's 32,300.
Seth, did that say if it was a new or used?
I apologize. This one says that it is it doesn't say on the bid, but on the envelope that it says that it's a 2022. And this one's from Mountain States Equipment out of Grand Junction. And it is a RTSC3 trench roller. Need somebody to decipher this for me, apparently.
Daniel, I'll give him a hand.
I'm just trying to find you a dollar amount here. Show me where I'm missing it. Get all the sheets out. Yeah. Okay, this one says that it's a 2022 and the final price is $39,960.
Any questions or
Do
concerns?
they meet your specifications of everything you need in the trench compactor?
It's all the specifications of what you need.
I'm not familiar with the one model that was quoted. I'll have to review the specifications there.
Should be able to turn the lights on right there.
We're getting close to Halloween. It must have been a goblin.
Yeah, that was Casper. That wasn't me that turned it off.
One thing we'll also need to verify, the one notes that there is a 5-year warranty. The other does not have any warranty information.
I'll make a motion that we turn the bids over for review and some clarification from the vendors acknowledging that A1 was the low bid.
And I'll second that.
Any further discussion? All in favor?
Aye.
Aye. Motion carries. Item 4 is open sealed bids for cab and chassis truck for the Carbon County Road Department.
And there's one bid for this one. This one says it's from Price Chrysler, Dodge, Jeep, and Ram. It's a mouthful. This is a 3500 regular cab chassis 4x4 for $61,945. It's a 2023.
Any questions? Is that what you were after, Daniel, I think, isn't it? Okay. Any discussion?
I don't have any discussion. I would say that we acknowledge the bids, let Daniel review the paperwork, make sure it's what he wants, and then if it is, move forward with the purchase of the vehicle.
I'll second that.
All in favor?
Aye.
Aye. Motion carries. Maybe just a note here, our road department has had several purchases this year, but if we want our roads fixed, we got to have equipment and trucks that work. So we have a very aged fleet that's in some ways some serious trouble. So this is not the end of it either. Next year we'll have to replace some things. So thank you, Daniel, for the work you guys are doing. Item 5 is review and possible approval of the 2023 marketing agreement with Utah.com. Shani Wilson.
That agreement, but what questions do you have? So basically, Utah.com provides marketing materials such as ads, banner ads, leads for visitors, and the co-op grant that we received will help pay for some of that advertising for Carbon County. So
A lot of the TRT money that we get, the county receives, has to be used outside the area.
yes, that's correct.
And try to draw in more folks. So a lot of that money is purposed for this type of thing, correct?
That's correct. Yeah.
So this draws in more folks and kind of brings in some revenue. It's nice to see them come in for the weekend and
Absolutely.
stay at the hotels, stay at the restaurants, buy some gas and food, and then go home, right? So
Yes.
Very good. Any questions for
No questions.
Okay.
And as long as they don't have to get the search and rescue out too, right?
Can I have a motion?
I'll make a motion to approve the 2023 marketing agreement with Utah.com.
And I'll second.
All in favor?
Aye.
Aye.
Motion carries. Thank you, Shani.
I'm just going to stay up here if that's okay.
Item 6 is review and possible approval for contract with Zartico to collect visitation data, funding through the 2022 co-op marketing grant.
Yep. So this is the same grant that will help us with the Utah.com. But basically, it's a destination operating system, and it will help the tourism office promote local destinations. So it does all sorts of tracking as far as geolocation data, spending data, event data, on where visitors are going and residents are going within Carbon County. The great thing I love about this is it's super user friendly. We get to kind of pick and choose what we want them to showcase and report on. And we can go in and look up that information and really help us decide where we need to put some of our marketing efforts. But it lets us know how we're performing against ourselves, which I think is important, and with other destinations. So those are the things I really liked about Zartico. Plus, comparable as far as pricing, they were really comparable to some of the others we've looked at over the last few months.
So as you might remember, this was on our commission meeting last time, and I asked for it to be tabled upon some counsel. And as I've done some further study into it, I think there is some value to this, but we have to make sure it's like anything else. If we get it and don't use it, it will do us no good. As I did, the founder or the CEO, I did some training with him, and he showed me how the program worked. For example, if the bike events have been very popular in our community, the bike races, they can take that data and show, as those people come into the community, show where else they're going, and where they're spending their money and their time as they're coming in and out of the community. So I think there's some huge value, and then you can take that data and specifically target where you're pushing those visitors as they come in for the bike races or soccer tournaments or whatever it is as they're coming in from outside the community. It also shows how our locals are interacting with the visitors as far as traffic patterns and where congestion might start happening and things like that. So it gives us some ability to plan for different events in different ways if we do it properly and use all the tools. And they do most of the development or most of the data processing for us. We just need to tell them what we want.
Yep, exactly. So, thanks, Casey.
I think it's worth a try.
Thank you.
And I think it's good for the residents too, and the local businesses. I know in that first mountain bike race, we also had a softball tournament, motocross, and a golf tournament, and there were some restaurants that ran out of food. They didn't anticipate so many folks showing up. So now, with this type of tracking, we can find out where the folks are, what they're doing when they do come here, what restaurants and all that they kind of tend to go to. So I think it's good information to have. So.
Any further questions or discussion? I'll entertain a motion.
I'll make a motion that we approve the contract with Zartico to collect the visitation data.
I'll second that.
All in favor?
Aye.
Thanks,
Thank
Shane.
you. Thank you.
I guess one more thing to note on that, they're going to do a look back as well. They're going to go back to 2019 and give us kind of a look back of everything that's kind of happened in our community as far as events, and tell us so we can start to already predict some of those traffic patterns and some of those visitation patterns. So it'll be helpful right from the get-go and not just moving forward.
Yeah, they've pulled some data when we sat through it. It's really cool to see kind of where people were going back then. So, okay.
Thank you.
Maybe just a quick thank you for Commissioner Hopes and Shani and Tina and all of the tourism board.
that have spent a lot of time over the last year working on improving the tourism effort here, and our tourism tax dollars are increasing, so the traffic increases. Just doing a great job, so thank you. Item 7, Carbon Medical Service Association, introduction and opioid settlement discussion. Carolyn, and it looks like you got everybody with you. Nobody wants to come up though with Carolyn. We should make them all come up. Yeah, just come up and line up so we can get a good picture.
We have moral support here. I brought it with me. Thank you for having us for tonight's meeting. Appreciate it, commissioners. I just wanted to stress, that we've applied for the opioid settlement, and I just wanted you to know a little bit more detail about Carbon Medical, and that's why I brought all this support. I thought maybe each one could say just a little bit, introduce themselves. And I've been with Carbon Medical for 21 years. When we started, we had 11 employees. We have 70 employees now. And I handed Tony some information about our economic impact. We haven't had this study done since COVID, but this was 2019. And since that time, in 2019, we had 42 jobs, and now we have 70. And at that time, our economic impact was $9.4 million in this area. So, I think we're a significant employer, for this area. And you can read those papers at your convenience. Carbon Medical, as you know, has medical services. We have MAT certified providers. All 7 of our providers are MAT certified medication addiction treatment.
So just for the public, because we have a lot of people that tune in, when you say an acronym like MAT, medically assisted treatment, will you please spell that out, or just
Okay.
say the full instead of
Say
saying
that.
the
Okay.
say it
Sure.
so that people know what you're talking about.
Okay. They are allowed with that degree to prescribe Suboxone for addiction treatment. And along with that, our therapist, we had one when I started that was contracted part-time. Now we have 5 full-time therapists, LCSWs, CMHCs. That's their license, their title. So when a person with addiction comes in and they see a provider for Suboxone treatment, along with that, they are required to have therapy. And so they're referred to our therapist. And then we have a pharmacy in Sunnyside and in Helper. Russell Scow can't be with us today, but he's the pharmacy director in Sunnyside. Mike Smith is the pharmacist in Helper. Not only is it just for our patients, but this is their outside retail pharmacies also. We offer x-ray. We offer full lab services. We offer vaccines. We test for Hep C, which goes along with, as you might know, with the patients with addiction. We test for Hep C and HIV. So all of this is like a full care for our patients. And also we have dental. I almost forgot. We have dental here. We have the dentist here today. We receive grant money from Health Resources and Services Administration, and that allows us to serve patients on a sliding fee scale if they qualify for sliding fee due to income and family size. So this helps our, lower income patients. But not only do we receive that money for the sliding fee, we also see Medicaid, Medicare, and private insurance. So, we have excellent providers, and we see all all patients. The grant money that we receive is only 34% of our budget. So, we rely on those other patients that come in to serve everyone. We also work well with Four Corners. We refer a lot of patients to Four Corners, and we work really closely with the health department to serve our addicted patients and for this opioid settlement. Dr. Williams is here, and he's our medical director. He's been with us since 2013? Yes. Yeah, and so he's our medical director. Let's see, where's Dr. Perkins? He's in the back. He's hiding. Dr. Perkins sees patients in Helper and also in Sunnyside. Courtney Atwood, she's a DNP. She's our medication addicted treatment coordinator. So when a patient comes in and they want to get some help, the provider will refer them to her so she can get them set up in our program. All of them, though, we'll take care of their addiction and their other care. This is, let's see, where do we go from here? Dane Kill, he's our behavioral health director. And under him, he has 4 other providers, therapists that sees patients. Haven Hall is our clinic director at Price Clinic. We just opened that clinic last year, about June, and did the ribbon cutting not too long ago. She's a nurse practitioner and also medication addiction treatment. This is our dentist, Dr. Jordan Kofed, and he's part of our team so we can have the full care of our patients. And dental is in Sunnyside. Lisa Clark is our COO, our Chief Operations Officer. She keeps us on track with our data and information that we need to keep track of everything. Judith is a pharmacy tech in Sunnyside. She goes back and forth between Helper and Sunnyside to wherever the schedule needs her. And we have, last but not least, Amanda Pye. We're ran by a voluntary board. We have 11 board members, and Amanda is one of our board members. And we're real happy to have her. I would appreciate if somebody else would want to talk.
Nobody wants to.
Yeah.
Cameron Williams, MD. I've retired from the emergency room in 2013 and went to work with Carolyn's invitation, working in the clinic in East Carbon, seeing patients, admitting patients to the hospital. And then when one of my old ER buddies decided to come work for us, I sort of retired again. So Dr. Perkins took over. Turned out he didn't like administrative work. He liked seeing patients, but so now I get to do the administrative work and leave all of the heavy lifting to this crew, who I absolutely admire. They just do a wonderful job. So I'm very proud to work with them, and I hope our relationship can continue for a long time. And I hope that some of the opioid settlement money can help support the medical assisted treatment of addiction in the community through whatever mechanism we all support each other in this effort. So I have the questionable honor of representing the county as your jail physician, and work closely with the sheriff in this regard, and we're trying to change some things there to have better alignment with care in the jail system with these folks and with Four Corners. So it's a process that's under review and being advanced as we speak. There are going to be a lot of changes within the next 2 months, at least from my perspective. So if you have any questions, you're welcome to call me. I'll have my number, know where to reach me. So
Thank you.
I'd like to introduce Dr. Kofod. He's one of your neighbors, Tony, so you need to get acquainted.
Just before Doctor, you speak, we got word today that the money the state's receiving, they're going to set some of that aside, and there were 2 areas that the counties could request additional funding, grant money from them, and one was specifically for the jails and the treatment in the jails. So that'll help add some more money to that.
Did you want me to say?
Yeah, sure.
I didn't know if he's introducing me or telling me to talk. All right, I'll just say something real quick. I'm Jordan Kofed. I'm the dentist in Sunnyside. I've been here since March, so new to the area. I've been really impressed with the staff that we have at Carbon Medical. I don't participate in addiction treatment myself, but I've seen it in my patients, and it changes their lives. So helps them get back on the right track, and I can help them get their teeth back in shape and some confidence, and get them back to living normal life. So I think it's a great thing.
Thank you.
Yeah, Dane Keel, behavioral health specialist. I have the opportunity to serve people, to help people with trauma, to help people with addiction, as the rest of my team, Daniel Gibson, Gypsy Everett, Danette Moynier, Devin Edwards, and Bailey Cave. This last week, we saw 163 people, people with hopes, people with dreams, people with severe addictions, severe traumas, but people nonetheless, and we're grateful to do this. Even during times of COVID, we grew where most of the state did not with behavioral health. We grew from 1 therapist to 5 therapists and a peer support specialist, and we plan on growing. Happy to be here. Thank you.
Thank you.
Thank you.
I'm Courtney Atwood, like she said. I am a family nurse practitioner with Carbon Medical. I've been here for 5 years now. I have a personal and professional interest in opioid addiction, lots of addictions, especially our issue of opioid overdose in these counties. I did my doctoral defense on opioid overdose awareness in primary care. It has been a big focus of my practice since I've been with Carbon Medical. We generally, on average, see and treat 120 to 150 patients for addiction. Ranges all variety of addictions. We have a very open mind at Carbon Medical. We have spots available that we can take someone that just is coming off of the street, wants to get off of an opioid and wants to get induced onto therapy and to live a sober life. So we are very open for these patients, and we've made a lot of accommodations for their treatment and their success. I recently had a discussion with Jeff Wood a couple nights ago when he rang my doorbell. I kind of caught him there in a moment, but I'm very excited with integration into jail to get treatment in there, because as you guys know, there's a big gap in care between release and treatment, right? These patients are getting released with not a lot of resources, no money, no insurance, not a lot of places to go other than to use again, because they don't want to be sick. They want to be better. This is a disease, it's not a choice. And they just want to be better, but they don't have the resources to get there. And that's what we hope to provide them. And we're doing the best that we can with the money that we are made available with. So this money would greatly impact that. And hopefully that we can continue our great relationship with jail and sheriff's department and getting these patients the help that they need so that we can decrease recidivism and that we can get these families and their loved ones into treatment and long life sobriety, not just short term, to get them through. So that is my hope. So thank you.
Thank you.
I'm Haven Hawk. I'm a nurse practitioner at the Price Clinic. So I do treat with Suboxone and Vivitrol for medication-assisted treatment, along with Courtney and the rest of the gang. But I'm also the resident pain nerd. What we know about the addiction crisis in the U.S. over the last 30 years is that it really started with pain, chronic pain especially, and that it was poorly managed due to poor information, right? And so we know chronic pain is very complicated. It is increasing in the U.S. by about 10%. It has gone up since 2002 to 2018. That's over 10.8 million people, with more people with chronic pain in our country. So we do address pain differently at Carbon Medical. We try to deal with it very safely. We try to teach about self-management tools and ways that people can decrease pain on their own, empower people to be in relationships and deal with stress and sleep better and have better nutrition and all those things that we know help the complicated nature of what pain is. So we really do approach it comprehensively, like Carolyn said, and I think that's an admirable thing.
Thank you.
You guys know me, but I just want to thank you guys for allowing Carbon Medical to come and speak. Obviously, I'm not clinical, have not been clinical, but I have been in a very unique position over the last 5 years and over the last 20 years working throughout our community and watching our opioid crisis and our substance use disorders grow and feeling like we were living in a community that was almost on the verge of collapse. But I would like to commend our county officials all across the board for all of the work that I feel has been a grassroots effort, because I feel like we are coming not necessarily just to our own aid, but we have seen the problem in our own community, in our own backyard, and we've decided to clean it up and do whatever we can to help these individuals struggling with substance use disorders. And so I just would like to thank all of you for all the work you put in every single day. Individuals such as Carbon Medical, Four Corners, the Health Department, USARA. I look at the resources available in our own backyard that have just continued to grow, and it definitely gives all of us hope for the future. So to hear about the opioid settlement funds that will be coming down the pipeline, I'm really excited to see how they're going to be utilized and the additional growth and improvements we're going to see in all the people that we know and love that have been ravaged by this disease. So thank you guys.
Thanks.
Thank you.
Judith's being all quiet because she was sent by the pharmacy director, and she's one of our pharmacy techs. So she sees a lot of this full hand. So I'm not going to let you get out completely. I'm at least going to acknowledge you, Judith. Like Courtney, you know, this has hit home too. Bailey Cave, our CPSS, is my niece. And she's come a long way in her 22, 23 years. And so I know that I'm not the only person in this community that feels this way and has seen it firsthand, whether it be your niece, your brother, your neighbor, your friend, your, you know, whoever. My sister-in-law died from an opioid addiction overdose. I mean, it's hit hard. And we are a longstanding, my family is known very well throughout the community between Critchlows and Caves. And so the idea that it can't happen to you, it happens to you, whether it be directly or indirectly. So that being said, sorry, I've got emotional when it comes to this. Russell Scow, I don't know if he was the first pharmacist, but Russell Scow, when he came on with us, jumped right in, took the medicated assisted treatment program along with our providers, I believe with Dr. Perkins, right out the gate. And what a resource we have there. You know, our providers, if they have questions, need some guidance, Russell is top notch and has, like I said, gone through all of those trainings to just really be a huge asset, you know, when it comes to our opioid addiction patients. So I wanted to say that about pharmacy. The other thing is, I also have been with Carbon Medical for 21 years, and I've seen it grow from the 11 staff members to obtaining helper clinic, opening price clinic, and growing to 70 employees. It's a huge growth for us in this community, I feel like, and I feel like that each of us are committed. The reason we have been able to grow our staff is because they're all committed to the issue that we're discussing right now. Every one of our providers are MAT assisted treatment certified. They have their XDEA. They were the first to jump on board. You know, once it was available and they knew about it, they all jumped on board. And it's now a requirement for any provider that works within our facility that they get MAT certified. We're looking at bringing on a psych, mental health nurse practitioner to help with this addiction. We're looking at, you know, as you know, growing, expanding, and all of this is to directly impact those patients, those opioid addicted patients that we want to help. We need to help. There has to be an end somewhere, and if there's not, we're going to do our best to try to get there. So that's what I got to say. Thank you.
Thank you. Thank you, Lisa.
You see why I brought them along. I really appreciate you taking the time to hear our stories. And I did want to mention that we are looking at a building in Price that's a lot larger than the space that the Helper Clinic or the Price Clinic's in right now, and would use this money towards that building. And also towards transportation. We have started transportation services for our patients, not to go over the mountain or anything, but to come to our facilities for their appointments if their car doesn't run or whatever. And so we would use any of those funds to help increase our services. I appreciate it.
Well, thank you.
Thank you.
Appreciate all of you coming. You provide a valuable service to the community, especially those that are at most at risk. So thank you. Thank you.
Thank you very much.
Thank you. I just want to express my appreciation. I know I've worked with Haven and Amanda and several others as we started the CARE Coalition and the Carbon Emery Opioid Coalition, and you guys have been at the table from the beginning trying to address this issue. So thank you.
And I'm just glad to see my neighbor has a sports jacket. I've never seen that before, so. You clean up well, Cam. Thanks for what you do. Appreciate it.
Yeah, and we have not received the money yet. We've been told we should have seen it in July, but attorneys are involved, so. And we signed some paperwork last week that hopefully that'll facilitate, we can get that in hand, so. And we got to make a decision what to do with it. So we appreciate your being here tonight and making this presentation. Let's see. Item number 8 is ratification and possible approval to amend the ongoing agreement between the State Health and Human Services and Carbon County Family Support Center. Shelley Wright.
This is our agreement, our ongoing contract that we've had with the state for, oh gosh, almost 30 years. So this is amending the contract to address the contract starting July 1 and ending June 30th. So it just needed to be signed before today. And so I appreciate you guys putting it on the calendar and ratifying this. So thank you.
These funds go for the
Our crisis nursery.
Yeah, the crisis nursery. So a lot of the operations that you do are funded by grants, and you have to keep track of all of these grants and when they start, when they end, the matches and all of that. So thank you for your efforts in that.
Thank you.
Tell us what the crisis nursery is for those that may not know.
Okay, yes, for sure. So we really focus on child abuse prevention services, and we do that in several different ways. We provide crisis care for families in crisis. So it could be any type of a crisis, medical crisis, domestic violence situation. It could be a stay-at-home parent kind of at their wit's end and they need a break. Maybe they have a challenging child. And they just need a break. So we provide that respite for those families. We provide the overnight crisis care for families that don't have other supports in the community. maybe a parent dealing with an opioid crisis might need additional childcare and support. So we care for those kiddos that you guys are caring for those adults. So it's pretty awesome. We also provide parent education classes, and we also provide home visiting in the homes of our new moms.
Thank you. Any questions for Shelley?
I don't have any questions. I appreciate what you do.
Thank you.
I'll make a motion to ratify the agreement between the State Health and Human Services and Carbon County Family Support Center.
And I'll second.
All in favor?
Aye.
Aye. Motion carries. Thank you.
Thank you. And I'll just stay up here because I think I'm on the
Okay.
agenda for the other item.
Item 9 is consideration and possible approval of the subcontract agreement with the Family Support Centers of Utah and Carbon County.
Okay, so this is new funding. The Family Support Centers of Utah approached the legislature several months ago to get more funding to fund our programs. We have very little funding. The legislature agreed to put us on their in their budget ongoing. So in order to do that, we had to subcontract with the Family Support Centers of Utah. There are 17 Family Support Centers across the state. But the Family Support Centers of Utah will contract with the Department of Health and Human Services. And it's to support our current crisis nursery care services. So same type of program, but it's just additional funds to keep us going and hopefully have the opportunity to grow our programs.
Another one that you track. So again, thank
Another
you
one I
for
track.
keeping these all straight.
Yeah.
And I'm a social worker dealing with budgets, so it's.
Any questions?
No questions.
I don't have any questions. I'll go ahead and make a motion that let's see, we approve the subcontract agreement with the Family Support Centers of Utah and Carbon County.
I'll second that.
All in favor?
Aye.
Aye.
Thank you so
Motion
much,
carries.
Commissioners. I
Thank you.
appreciate it.
Thank
Okay,
you.
Thanks.
Item 10, ratification of the mutual confidentiality and non-disclosure agreement between Carbon County, Price City, 7-County Infrastructure Coalition, and SCS.
Wants to take this one? Do we want to say why we're doing this? Can we say why we're doing this?
Yes, maybe a brief explanation. We're working with a company that is looking to come to Carbon County. They don't want for us to keep secret that they're looking at coming here, but the process of their business, how they make things, is what they don't want anyone else to know what's going on. So we've signed a non-disclosure agreement with them to not disclose any of their process with anybody. So this is actually would be a pretty big boost to the county if these folks come here. A major boost. So we're working hard with them to have a public-private partnership and try to encourage investors who they need to gather up a large sum of money from to feel confident that our community is supportive and that as a government entity there's a little skin in the game from our community here. So that's our attempt.
Do we want to say where or any more details? I mean, it would be south of the county, I guess we could say. The numbers of employees, it's a couple hundred to build a facility, maybe 100 employed afterwards. Want to walk that line too tightly, but as Commissioner Jensen said, this company is an established company. They're legit, and they have operations on both coasts, east and west, and they're looking to this area simply because of the kind of some of the demographics here, the sandstone that we have that's over in Drunkard's Wash as well. So a lot of things have aligned for this company to move into Carbon County and they're very excited about it, as it seems that their investors are as well. Did I?
Yeah, and I guess
Is that okay?
the one thing that they will use is a fairly large amount of coal. So as we have our coal mine decline and the power plants at some point transfer from coal to something else, this helps keep the coal mines open. So we're very encouraged by it. Want to be very supportive. Any other discussion you want to add?
Nope.
Okay.
Covered it well. Thank you.
Entertain a motion to ratify that.
I'll make a motion to ratify the mutually confidential and non-disclosure agreement between Carbon County, Price City, 7-County Infrastructure Coalition, and SCS.
And I will second.
All in favor?
Aye.
Aye. So there's a lot of folks involved in this effort. Price City, 7-County Coalition Infrastructure. So we've got quite a team gathered together to work on this. So. Item 11, consideration and possible approval of the Lexus Plus subscription agreement for Carbon County Attorney's Office. Lynn?
So LexisNexis is an online database that's essential for computer-assisted legal research. It replaces a law library, and it's essential for the attorney's office to stay in compliance with all the laws out there. So it's a monthly subscription. It's something that we've had, and it's just ongoing.
It's $60 a month more than it was last year. We pay monthly. And then with the $60, there's a $20 per month increase each year after this. This is a 4-year agreement.
Yes, so it's a 4-year agreement. It automatically renews each year.
Any other questions?
I don't have any questions.
No, I'll go ahead and make a motion that we approve the Lexus Plus subscription agreement for the Carbon County Attorney's Office.
I'll second that.
All in favor?
Aye.
Aye. Motion carries. Item 12, consideration and possible approval of ECDC request for a rate increase. Commissioner Hopes.
As is normal, every year we visit with Republic Services for our disposals of our waste in Carbon County. All of it, all of our municipal waste goes to ECDC or Republic Services. There's two things at play here. The overall amount, and then based on the amount of waste streams that they bring in from other communities, sets a tiered, a high, medium, and a low tier. We're not talking about the tier. We're just talking about the percentage increase to each one of those tiers for the services for the municipal waste that's handled by ECDC. They've requested a 6.5% increase, but we don't have to give that 6.5% increase. That would be a direct impact to all of the residents. That is paid on each of our garbage cans or our dumpsters that we pay at our businesses or at our homes. If we have them at our homes, that would be, we would pay an additional cost that the company that picks those up is City Sanitation. They would pass that cost on to us as the consumers of the service. And we also have other dumpsters that we pay directly at the county, at the landfill, and also at Schofield, where we pick up the roll-off bins for those communities, and also at landfill. So I guess unless there's questions, we can talk about what we're willing to increase, or if we're willing to increase. pass that on to the constituents. Obviously, you know, price of fuel and everything's gone up, so that's part of why they're asking for this. But it's gone up for everybody too, so.
And wasn't it, am I correct saying that last year there was a tier increase as well as a rate increase?
Yes, in 2021, because of the pandemic, most of the construction and stuff in California where they get a lot of their waste stream was significantly decreased. And so we ended up jumping from, I believe, a middle tier all the way to the high tier. And so we paid the highest tier, and we gave, I believe it was a 3%. Do you remember, Seth? A 3% increase.
They asked for
a 6.
Yeah, we gave them half of it.
Yeah. So I believe they're doing better. So there's a chance that we'll go and that back down to a more moderate tier, because their waste stream has picked up as we're coming out of the pandemic. A lot of these projects that were on hold are now moving forward. So there's a possibility we could move down to that middle tier.
Has city sanitation give us an indication on the homeowner how much that would cost based off the 3% that was initiated a couple years ago?
I don't have that information.
I guess the point I'm trying to make is it's probably not a lot of money for the dumpster out in your front yard. The weight is pretty small that's in your dumpster, and I think they collect around $30 a ton for that material. So what they pick up at your house is a pretty light amount, but 6% is 6% of what it's been.
Yeah, and you know, we're all struggling we're all feeling the pain of inflation and everything going up with expenses. So I understand why this company Republix wants to increase and ask for an increase. I get that, but I think it's kind of tough in my mind to give a 6.5%. I think that's, you know, if we could whittle that down to half or less, I think I'd be more amenable to that. But I'll just throw out, how about a 2% increase? Is that too low? Is that in these times just where it needs to be? I'll throw that out there.
I think that's fair, and if they don't think, if that's something that they can't live with, we can start the negotiations at that point, I guess.
Okay.
You want to make a motion?
I'll make a motion then that a counteroffer, I guess, would be instead of a 6.5% increase for Republix, that it would be a 2% increase.
I'll second that motion.
All in favor?
Aye.
Aye. Motion carries. Item 13, consideration and possible approval to file a new opioid complaint against McKinsey and Company. Lynn, would you take that one?
Sure. So McKinsey and Company is a global consulting firm that was hired by Purdue Pharma to try and increase the sale of opioids. There are now complaints that are being filed against McKinsey and Company for their part in the opioid crisis. And this document that's before you is necessary in order to protect our rights in case of future settlements, so that we'll be included if there are future settlements against McKinsey and Company.
Do you know if this information is for the whole entire, the entire state? The reason I ask is because the last time we had this pop up, we had certain counties and cities that were kind of balking at it and trying to go a different direction. Does this have the same parameters as the last go around?
In general, they try to consolidate as much as possible. So I would assume it's comparable to the other ones that came through. there's so many different parties out there that are wanting to file against the companies that it's overwhelming unless they consolidate.
Thank you.
Any other questions or discussion?
No questions.
Have a motion?
I'll make a motion to approve to file a new opioid claim against McKinsey and Company.
And I will second.
All in favor?
Aye.
Aye. Motion carries. Item 14, ratification of the Utah Subdivision Agreement to establish Utah Attorney Fee and Expense Fund in regards to the opioid lawsuit settlement. And it's been recommended that that be tabled. It's not quite ready yet.
Yes, it's still in draft form, so it would be better to consider it at a later meeting.
Okay.
I'll make a motion to table.
I will second.
All in favor?
Aye.
Aye.
Motion carries.
I move that we adjourn.